this is the reality. Like 88% of Asian people can be had that virus. But because you didn't know it until you proven that you have the symptoms. So I would just suggest that, just done a test.
I do hear that amongst the Asian population that there is a sense of shame with hepatitis B, but I'd just like to say there's no shame in any disease at all.
I gather you would have had the hepatitis B core antibody done, which, if being positive, shows that you are a carrier and do have hepatitis B. From my point of view, it's mainly a matter of monitoring and seeing whether you've got this condition called cirrhosis. And we take it from there. I'll write a referral to the liver clinic, say at the Austin Hospital, which is which has got a very good clinic, and it's not that very far from here.
Yeah, that's good. That's good. Thank you.
So is this your first time at the Austin?
Yes.
Okay, good. So my name's Brenda. I'm one of the nurses here. So I'll just explain to you. When people come here, particularly for their first visit, it's really important to be empathetic and respectful and to treat people with dignity. I think every time somebody has a positive experience in a public hospital, it's health promotion indirectly, and particularly with B, because if you've got people coming in with hepatitis B, it will often be that other people in their family have also got hepatitis B. And if they have a good experience, they will bring them to the hospital and get tested and treatment if necessary. And can I ask where you were born?
In the Philippines.
In the Philippines. So how long have you been in Australia?
It's about 8 years now. I didn't have any knowledge about that hepatitis B virus when I was in my own country. Then when I came in here, when I get pregnant to my third daughter, that's the time that I have the thorough laboratory and knowledge in regarding with that virus.
Now, do you have any I'd have to say that most patients who leave here leave enormously relieved. I think it's incredibly important that they see a friendly face, that they get a phone number that they can ring if they've lost their bits of paper, they can't remember what I said, and then you know that they'll come back for subsequent visits. Do you have a partner?
Yes, I'm married.
You're married, okay, and your partner is vaccinated?
Yes,
okay.
They're all vaccinated. I have 3 girls as well.
Oh, you got 3 children, okay, that's great.
They have all hepatitis B vaccination.
Oh, that's great. So you know that in Australia...
What I do after I find that I was a positive in hepatitis B virus, I cannot do much. It's just like you have to continue your life, because I never feel I'm sick. I never have the symptoms, I never had anything. So I can just continue what I'm doing. Like sometimes I'm smoking before, I'm drinking, but I still don't have the symptoms of anything. But like what the doctor was saying, the symptoms will come out when your liver is in a worse condition.
I've been in the job a long time, and I think that I know you can't give people too much information because they are overwhelmed and they shut down and they don't hear anything in the end. So what I try to do is give them written information in their own language that's simple from a gastroenterology site so that it's good information. The other thing that I do is I speak to maybe 3 or 4 main points, and then at the end I ask them if they've got any questions. And if they do have questions that they remember when they're at home, like I said before, just pick up the phone and ring us and ask us the question. And I'll book an ultrasound for you and a FibroScan. So the ultrasound will just tell us if there's any lumps or bumps in your liver. And the FibroScan is a new thing that we use instead of liver biopsy. So it doesn't hurt. And it'll just tell us if you've got any
scars or something.
It'll tell us.
If their liver is swelling or something.
That's exactly right. So once we've got all that information, then the doctors will be able to tell you
if you start there.
If you need treatment or if you don't need treatment.
Your GP's referred you here because you've been diagnosed with hepatitis B. Is that right? Yeah. What I'll do is I'll just pull up your file on the computer. Then we look up here, we look for any muscle wasting to make sure there's any nutritional problems, any bruising. Because if your liver doesn't, if your liver starts to worsen in function, then you then
easily get bruises.
you get easy bruising.
I think the most important element of my role with any disease in this clinic is that people find us easy to contact, easy to talk to, that we develop a good relationship over time, and we have a lot of people that have been coming here for a long time, and it does become, you become like old friends, you really do. And they need to know when they leave here that there's really good treatments for hepatitis B, because a lot of people coming here don't even know that. So that's pretty scary, to be diagnosed with something and then to think there's actually no treatment for that something.
It's nice to share some experience like this, and you're thinking that maybe you can help, because as I really believe that precaution is better than cure. So if you know earlier stage, and you will do a lot of option for yourself, it's not too late.
So you push through these areas of weakness. So the way we